When you have a member of your family, a child, as I did in my case, become so ill in such a complicated way and you're so helpless, you do what you can. I did what I could to feel as if I had some control over the situation. When Tom first fell ill, right back at 6 months old, I guess I got into that habit of keeping very, very detailed notes. And yet, when we went to see an ENT specialist for the difficulty swallowing, and obviously we were sent to see an education specialist for what was happening at school, and nobody had that full picture. And if the system doesn't allow that, then it's failing us.
Like Nom, I have similar challenges around getting access to patient data that I need to support my research. What we want to be able to do is have an ability to access the data in one location and be able to operate on the data at the same place at the same time.
With these challenges in mind, and they are numerous, we're talking about data flows from perhaps 90, maybe more different source systems. We knew we needed help. And in order to do that, we turned to Telefónica Tech and Starlight.
Large-scale health and data programmes within the NHS require careful management in order to deliver them successfully. They're not just a technical challenge, they're first and foremost a people and organisational challenge. So we started by working with providers locally to understand what they would require in order to contribute and participate in the programme, and help develop an approach to engaging with over 15 to 20 trusts, various other health and care bodies, to agree an approach for data sharing, for commercial value and intellectual property that provided an environment they could successfully contribute into this programme.
There wasn't a solution that was just out of the box. A lot of what we've developed has been experimental and first of its type. So the approach around agile, engaging, developing very fast and failing fast has been brilliant throughout the project.
One of the things that was really lovely was the technology transfer, the knowledge that we managed to gain from them. They took real pride in making sure that our team was upskilled and able to manage and maintain the warehouse moving forwards. Bringing us up to the present, we're now a live secure data environment. We have processed over 30 billion rows of data so far. There's a lot more left to do. We have some 100 users within our workspace, some 40 projects that have been completed. We hold data on over 4.5 million unique patients, which is linked across acute, community, mental health and ambulance. So really exciting, groundbreaking linkages.
For researchers, the SDE has allowed us access to data at scales and breadth that we've never had before. Not only do we have access to the NHS patient data, but we can now incorporate information such as social deprivation data, which will help nuance the way that we do our analyses, providing a holistic approach to understanding how to improve patient care.
What's really exciting for me about the secure data environment is that it's bringing together industry, it's bringing together academic researchers, clinical researchers, and hopefully that will bring us all together in one sort of shared vision of helping patients.
Ultimately, what we're most excited about is not the scalable reuse of routinely collected NHS data for research, and it's not even the ability to deliver more research of a really high quality. It's actually the impact that it's going to deliver to the NHS and patients both now and in the future.